Good morning, children. How are you all? Hope you are safe. So today we are going to discuss a topic which is called as vitamins. Okay, the topic which we are going to discuss is vitamins. As we have studied in the earlier classes, vitamins are the micronutrients. That means these nutrients are required in the diet in a very minute amount. They are required in a very less amount. So they are not required as you are taking the carbon dioxide or you are taking the fats and proteins, and also they are not required in those quantities, because those three are called as macronutrients, because they should be more in the diet which you eat. They should be maximum, they should cover maximum of the diet which you eat. But whereas when you come to the vitamins and minerals, these two are called as the micronutrients because they are not required in larger quantities. They are required in a very small quantities in the diet. So that's why they are called as micronutrients. So once you come to the minerals, iron, calcium, okay, so all these are the different minerals which are iodine, which are required to the body in a minute quantities. And so we are not going to learn about the minerals, but whereas we are going to completely focus on vitamins. Vitamins is a very important part of this lesson, because you may and definitely you will get questions from this particular table which we are going to discuss now. The table which is in the page number 19 is very important, because it covers at least 2 to 3 marks or 4 marks. You can make it maximum sure that you'll get at least 2 to 4 marks from this particular table. So if you are well versed with the table, it will be very helpful to you personally in the future to tell somebody regarding the vitamins, to give them, to inculcate them regarding the vitamins, importance of vitamins, and also at the same time they'll be very useful to you in the examinations. And also basically when you come to the vitamins are, they are required in the less quantities, minute quantity. That's why they are called as the micronutrients. Second thing is that they are not produced in our body. They are needed to be in the diet which we eat. So whatever the diet you take, the diet should contain the nutrients such as vitamins, so that our body can utilize them. And also secondly, they are also produced by or synthesized. Synthesized is a word. The meaning of the word is prepared. So the word meaning is prepared. So they are prepared, they are synthesized in our body. Some of them are in the body by the help of bacteria. Our body will not synthesize them. The bacteria which are present in our body will synthesize them. That's why our diet should be full of vitamins. So these vitamins are very important to us, and these vitamins can be categorized into two types. One is water soluble vitamin, second one is fat soluble vitamin. So if you see here the vitamins, right? So vitamins, they are as follows: A, B, C, D, E and K. So these are the different vitamins which are needed for our body, which are there in the diet which we eat. So what are the vitamins? A, B, C, D, E and K. Okay, these are the 6 vitamins which are required in our diet. Okay, they are required in minute quantities, but if they are not taken in a proper way, if they are not taken regularly, if they are not taken in sufficient quantities, the difference it makes, you cannot even imagine. That is what we are going to study now. What kind of difference it makes if you don't take them regularly, if you don't take them properly in the diet, if your diet is deficient of vitamins. What are the different problems you are going to face? We are going to study now. And these all vitamins can be divided into 2 categories. One is water soluble and second one is fat soluble. That means these are the 2 vitamins which are soluble in the water, and these are the 4 vitamins which are soluble in the fat. So here water soluble vitamins are B and C, and fat soluble vitamins are A, D, E and K. Is it clear, children? So water soluble are B and C, and fat soluble are A, D, E and K. So now we are going to learn about the water soluble vitamins first. So water soluble vitamins, we are going to see about their resources, deficiency, diseases and also symptoms. Okay, now all of you turn your page to 19. Come to page number 19 so that we can see one by one and we can learn all those things. Is it clear? So first of all, we'll go ahead with the B complex. Okay, it is called as B complex because there are different kinds of vitamins in it. Okay, you can see all the vitamins here: thiamine, riboflavin, niacin, okay, pyridoxine, cyanocobalamin, folic acid, pantothenic acid and biotin. So these are the different vitamins of B. That's why all together we call it as B vitamin. So all these 1, 2, 3, 4, 5, 6, 7, 8, all these come under vitamin B complex. So vitamin B complex is not a single vitamin, it is a complex vitamin where there are some 8 vitamins in it. So let me read the names out for you once again: thiamine, riboflavin, niacin, pyridoxine, cyanocobalamin, folic acid, pantothenic acid and biotin. So now here all these are the different kinds of B vitamins. Okay, different kinds of B vitamin. Now what will happen? Okay, now first of all we'll see what are the sources of this vitamins, and then we'll see the deficiency disease, and then we'll see the symptoms of this particular deficiency of this vitamin in our diet. If this vitamin is deficient in our diet, what is the disease we get and what are its symptoms? That's we are going to discuss. And if you don't want this vitamin to be deficient, then what are the sources where you can find this vitamin? Okay, very clear. We are going to see the sources, we are going to see the disease, and then we are going to see the symptoms. Okay, now first one is the thiamine. Thiamine is also called as B1. It's called as the B1 vitamin. Okay, so this B1 vitamin, actually this was found by the Japanese sailors. People who ate the rice, if they washed it thoroughly, and sometime when you boil the rice and all, like the starch which you get, you will throw it out, isn't it? So if that starch is thrown out, already we have seen that it is a water soluble vitamin. So whatever the thiamine which is there in the rice will get soluble in the water, and when the rice comes to boil, you throw the water out. That means what you will be losing? You will be losing the B1 vitamin, and because of that, chilled people used to get beriberi, a disease called as beriberi, and the people who are not throwing the starch like that, they were very normal. So that's how they came to know that, okay, this problem is because of throwing the water, so or starch. So that's why that is a basic source of this B vitamin, right? So that is thiamine, that is B1. So thiamine is the B1 vitamin which is basically present in the resources are cereals. You know what are cereals, right? Oil seeds, vegetables, milk, meat, fish and eggs. So all these are the different sources where you can find thiamine. Okay, and then the deficiency, if the thiamine is deficient in the diet which you intake, then the disease which you get is called as the beriberi. Now what are the symptoms? How you will be able to find that you are suffering from beriberi? Nowadays we are very much having a very good knowledge about the symptoms. So when I talk about the symptoms, everybody's mind will go to corona, right? What are the symptoms? Cough, cold, headache, fever, isn't it? And breathing problems. So these are all the symptoms which you see when you talk about the disease called as corona. So when you talk about the disease called as beriberi, then what are the symptoms? The first symptom what you see is vomiting. You will have the vomitings, and then there will be fits. So you might have seen the fits, right? Especially in the movies and all, like when the person gets fits and all, they will put the keys in their hands. That's a fits. It's a nervous problem. Okay, and then loss of appetite. Loss of appetite, that means the child will not, or the person will not have any kind of interest in eating the food, then that's how he will lose his weight and also energy. And then there will be difficulty in breathing. There will be difficulty in breathing, and also the person may get paralyzed. That means the hands and legs will not work, they will not be able to move. So these are all the kind of symptoms which you can find when a person is suffering from deficiency of thiamine in the diet. Okay, and our second one is the riboflavin. Second one is the riboflavin, basically called as B2. This is also called as B2. And where do you find this? You can find this in the milk, eggs, liver, kidney, green leafy vegetables, etc. So all these are the sources of vitamin B2, that is riboflavin. So now here we are very much well versed with this vitamin, because so many times you can see our friends with cracking of the mouth at the corners. You can see in the picture there is a cracking of mouth in the corners. Okay, that is a symptom of the problem called as glossitis. Glossitis in the sense glazed tongue. The tongue will become very sore and it will be red in color, and your mouth will crack at the corners. Okay, not only that, the other symptom which you can see is photophobia. That means you'll not be able to see the light. There will be a problem in seeing the light, and the skin will become scaly. The skin will become scaly, like you see the scales on the fishes, right, and on the snakes and all. No, those kind of scales you can see on the body. So not exactly like fishes and reptiles and all. The skin becomes here and there, it becomes like that. So these are all the symptoms. These are all the symptoms of riboflavin. That is, if there is deficiency of riboflavin in the diet which you eat, these are all the symptoms which you are going to see. So mouth cracks at the corners, red and sore tongue. Sore in the sense, whenever some chili powder, you eat some chili or some hot, then your tongue will start burning sensation. Okay, so that is how it becomes a sore tongue. There will be pain in that. You'll feel that pain. And then photophobia, where you'll not be able to see the light properly, and then the skin will become scaly. You can see the pictures over there. So this is about the vitamin B2. And third one is vitamin B3. Vitamin B3 is also called as niacin. You can find this niacin if you eat kidneys, liver, meat, egg, fish and oil seeds, then you will not have the deficiency of niacin in your body. Okay, so niacin, if it is deficient in the body, you will get a disease called as pellagra. Pellagra is a skin problem where the body will become scaly. You can see the scaly kind of skin, and also not only that, it also lead to the first one is dermatitis, in the sense the skin problems and all, right? Some problems in the skin, disease of skin. And then what else you can see is the diarrhea is one of the symptom. And third one is the loss of memory will be a symptom, that is called as dementia. Dementia is loss of memory. Sometimes you might have watched the movie called as Gajini, right? So the person suffers from dementia, loss of memory. Okay, and then scaly skin, as I have said, scaly skin. So if niacin is deficient in the diet, you will suffer from a disease called as pellagra, which is nothing but a kind of scaly skin. Fourth one is pyridoxine. Which is also called as B6. Okay, now where do you find this? What are the sources of pyridoxine? Cereals, oil seeds, vegetables, milk, meat, fish, eggs, liver. All these are the sources of pyridoxine. So this pyridoxine is basically present in the sources are cereals, oil seeds, vegetables, milk, meat, fish and eggs, and also liver. So sometimes you will throw the liver out, isn't it? So when your father gets non-veg and all, some people will not eat the liver. So it's always good to eat liver, because see here, you can get rid of this problem called as pyridoxine if you eat liver, right? So liver, cereals, oil seeds, vegetables, milk, meat, fish, eggs. Okay, all these are the good sources of the pyridoxine, which is also called as B6. And if you don't eat this, or if your food is deficient in this, you might come across a problem called as anemia. Anemia is loss of blood. So there is a particular percentage of blood in males and females, and that will become less if you don't take the pyridoxine properly. That will lead to a problem called as anemia. Sometimes the doctor will look at your eyes and say that you are anemic. That means you don't have proper blood in your body. Okay, boys, there should be at least 14 grams of blood. So sometimes you'll not have that. It will be some 10 or 12. Girls, it should be around 12. So if it is less than that, that means you are anemic. So you need to eat the sources which gives you blood. And what are the symptoms when you get this kind of, when the food is deficient in pyridoxine? That leads to, one is hyper irritability. So one is a hyper irritability. That means you'll have, for each and every small thing also you'll get irritated. So the irritation will go to peaks. That is hyper irritability. Second one is nausea. Nausea in the sense, a sensation to vomit. Not only sensation to vomit, that is nausea, but also the people suffer from the vomitings. And also you can see convulsions here again, that is fits. Okay, if you don't take the pyridoxine properly, then all these are the different problems, including anemia. Okay, and then coming to the next is cyanocobalamin, which is also called as B12. Okay, so this cyanocobalamin is a very important 1-mark question, because this usually comes in the examinations. Why it comes in the examination? Because this is the only vitamin which is synthesized by the bacteria which are present in our intestines. This is not present in the diet which you intake. Cyanocobalamin, that is B12 vitamin, is not present in the diet, but it is actually produced by or synthesized by the bacteria which are present in your intestines. Okay, if this bacteria are, or you can say, if they fail to produce cyanocobalamin, why I said if they fail to produce, because if you keep on taking the antibiotics for every small reason, these antibiotics can also kill the bacteria which are present in the intestines. So with the bacteria which are present in the intestines, which are very useful to us, they are not harmful to us, but they are actually useful to us. Okay, so they will not produce, no more cyanocobalamin will be produced. Then you will be subjected to a problem called as pernicious anemia. Anemia is you can say there is a little loss of blood and all, so you can take some medicines and that will get healed up. But whereas here, extreme lowering of blood, blood levels will go extremely low because of the pyridoxine, right? And what are the symptoms you can see is lean and weak body. The body will become lean in the sense very, very, very thin, and also you'll become very weak. That means you'll not be able to do any kind of work. You'll become very thin, and also you'll become very weak. Okay, and also less appetite. So this kind of people who are suffering from this pernicious anemia will not be in a mood to take good food. Okay, so they will not take food in the proper required quantities or a balanced diet. So these are all the problems you'll face when a person is suffering from deficiency of cyanocobalamin. Okay, and next one is the folic acid. So where is this folic acid present? It is present, what are the sources of that? Liver, meat, eggs, milk, fruits, vegetables, liver, kidney, and also eggs. So these are all the different sources of folic acid. So if you don't take the folic acid in required quantities also, that will lead to the problem called as anemia again. There will be severe loss of blood. So you might have seen the pregnant woman, they'll be taking the folic acid because they have to improve their blood. Their blood should be absolutely normal. So doctors will prescribe folic acid tablets so that they can maintain the proper blood levels. So if folic acid is deficient in your diet, what are the symptoms you can see here is diarrhea. that is motions. Okay. Second one is loss of leukocytes. So in 9th class we have come across the leukocytes, that is the WBC. White blood cells will become less, and then there will be intestinal mucus problems. The intestinal mucus problems you will see when you don't take the folic acid properly in your diet. The next one is the pantothenic acid. The pantothenic acid, the sources are sweet potatoes, groundnuts, vegetables, liver, kidneys, and egg. And if you don't take this pantothenic acid properly, if it is deficient in the diet which you intake, that will lead to a problem called as burning feet. Your feet will have burning sensation when pantothenic acid is not present in the diet which you eat, and if it is less in your body, then it will lead to the burning sensation in the feet. And then if there is a burning sensation in the feet, okay, and what are the symptoms you can see is walking problems. The first one is the walking problem. So you cannot walk properly. Okay, sometimes your leg may get sprained. You'll fall down because it will your foot will twist and you'll fall down and it will be a sprain, isn't it? So, and then that will lead to the walking problems and all. So what we need to do is we need to take the pantothenic acid properly and regularly. If you are eating sweet potatoes, groundnut, vegetables, liver, kidneys, and eggs and all, so you might not face this problem. Okay, and the last one in the vitamin B complex is biotin. Is the biotin. Biotin is present in the pulses, nuts, vegetable, liver, milk, and kidney. Okay, so if biotin is not deficient, if it is not in the diet which you eat, if it is deficient in the diet which you eat, that will cause nerve disorders. They will cause the nerve disorders. So what are the symptoms? The first one is fatigue. Fatigue in the sense you will get tired very soon. Okay, if somebody asks you to come to a particular place, you will hardly walk few steps or maybe 100 meters, and then you will get tired and you'll get exhausted and you want to sit at some particular place. That is fatigue. Okay, second one is mental depression. You'll be mentally disturbed. Okay, and that will lead to the mental depression. And third one, what you can see is the muscle pains. So if biotin is deficient in the diet, these are all the problems you can see. So this is about the vitamin B complex. So in vitamin B, we have read about the thiamine, we have read about the riboflavin, niacin, pyridoxine, cyanocobalamin, folic acid, pantothenic acid, biotin. Okay, and all these are together called as vitamin B complex. Okay, we have seen what are the diseases, and also we have seen their names. Okay, chemical names, that is B1 chemical name is thiamine, B2 riboflavin, B3 niacin, okay, and B6 pyridoxine, B12 cyanocobalamin. And also we have seen the deficiency diseases, we have seen the symptoms also. Okay, we have seen the sources also. And which is the most important vitamin B complex is cyanocobalamin, because it is not present in the diet which you intake. Then where it is present? It is not present anywhere in the food and all, but it is synthesized by the bacteria which are present in your intestines. Is it clear? So by this we come to the end of the B complex. The next vitamin of water soluble vitamin is C. Okay, the C vitamin C is also called as the ascorbic acid. It's also called as ascorbic acid. This ascorbic acid, the sources of this ascorbic acid is you can take green leafy vegetables, okay, citrus fruits like lemon, okay, and then fruits and also sprouts, molakettina vittanalu antaru kada, right? So, and also all the citrus fruits, all the fruits which belong to the lemon family and all, no, like you can eat them, santra, battai, lemon and whatnot, nimakailu. So all these things now, they will give you very good amount of vitamin C. And the cheapest source of vitamin C is guava fruit. Okay, so whenever you get guava fruits, eat them. That will give you very good vitamin C. And if the vitamin C is deficient in the diet which you intake, the problem which you are going to face is called as scurvy. It's called as scurvy. So scurvy, the symptoms you can see in two ways. One is delay in healing of wounds. The wounds will not heal properly. If you get a wound or something, if you fall down, that should heal in no time, but there will be a very good delay in healing of the wounds. Second thing is fractures of bones also will be very easy. They will not heal properly. So even the fracture in the bones also can be seen place. So make sure that you eat vitamin C regularly, and whenever you get these kind of fruits of lemon family or guava, eat them so that your body will not become deficient of vitamin C. The next is fat soluble vitamins. As we have discussed, there are 4 fat soluble vitamins, right? One is A, second one is, so the first one is A, second one is D, third one is E, and fourth one is K. So these are the 4 fat soluble vitamins. Out of this, we will start reading the first one, that is vitamin A. Vitamin A is also called as retinol. The word retinol has a word retina in it. Okay, that means it is related to eye. So if the food is deficient in the diet, if the food is deficient in vitamin A especially, your eye will get maximum number of problems. So it is must for you to take vitamin A food. So you should make sure that your food is not deficient in vitamin A. So vitamin A is basically present in the green leafy vegetables, carrots, tomatoes, pumpkins, papaya, mango, meat, fish, liver, eggs, milk, cod liver oil, and also shark liver oil. Cod and shark are the fishes, and their liver oil contains the vitamin A. So make sure that you eat them. Okay, so deficiency of vitamin A leads to eye diseases as well as skin diseases. So basically you can see maximum number of eye diseases. Okay, one is the night blindness. You know what is night blindness? Yes, the people cannot be able to see in the night. Okay, the day vision will be fine, but whereas in the night they'll become completely blind. They'll not be able to see anything, and that problem is called as the night blindness. Second one is xerothalmia. Xerothalmia is a problem where the outer layer of the eye will become completely dry. The tear ducts will stop releasing the water into the eye because the water is there, the liquid is there in the eye. The eyelids, when they come down and go up, it's a smooth movement. There's a smooth movement over there. Just imagine that your eyes are completely dry. So that kind of problem is called as the xerothalmia. The other word for the xerothalmia is dry eyes. That is a problem you will be seeing if you don't eat vitamin A food. Okay, and next one is cornea failure. So cornea is responsible for the sight, isn't it? It's present in the eye, and if this cornea fails, that will lead to the loss of vision. Okay, and then the next one is a nutritional blindness. Nutritional blindness, okay, is also called as permanent blindness. This usually comes in the children. Okay, when the children are not given proper vitamin A food, then the child will get nutritional blindness, and their eyesight they permanently become blind. That's why government has taken measures of giving them vitamin A food. If you take a proper amount of vitamin A, and you need not take it for again 3 months. 3 months it will get stored in your body, and after 3 months again you have to take the vitamin A food. So this is a very good step which is taken by the government, and they feed the government school children with vitamin A food every 3 months, so that they want to eradicate the vitamin A deficiency, that is nutritional blindness. So that's why they give the vitamin A rich food to the children every 3 months. Okay, and also you can see scaly skin again because we have also discussed that vitamin A deficiency lead to the skin disease, and again you can see the scaly skin in the people who are having the vitamin A deficiency. So, and the next one is the calciferol. Vitamin D is also called as calciferol. So if the vitamin D is present in the liver, eggs, okay, cod liver oil, shark liver oil, and also even if you go and stand in the morning sunrays also, you'll get vitamin D. Okay, so if you don't take the vitamin D properly, the problem which you get is called as the rickets. It's called as the rickets. So now rickets is a problem which you can see in few children in our surroundings. Okay, so now this is the kind of feet everybody will have. Now their feet will be attached like this. Okay, so the two knees will knock together like this. So now just imagine that the two knees are knocking and the child is not able to walk properly. Okay, how sad the situation will be, isn't it? Every one of his own age will be playing, okay, and they'll be walking properly, and because the child is not given proper vitamin D food and it was deficient in his diet, now the child is with rickets. So this actually, the symptoms you can see is improper formation of the bones. Improper formation of the bones. The bones will not form properly, and the knock knees, I said no, the knees will knock like this, and then the wrist will be swollen. The wrist will be swollen, and the dentition, the teeth which actually they have to come, there will be a delay in the dentition. Dentition in the sense here, delay of teeth, isn't it? The teeth, they have to come in certain time, so there will be a delay in that, and then bones will become very weak, and that means even if they fall down also, the bones will the bones will break. So that's why this vitamin D is also very, very important vitamin, and that should not be deficient in the diet. Okay, and the next one is the tocopherol. Tocopherol is also called as the vitamin E is also called as tocopherol. So tocopherol is basically present in fruits, vegetables, sprouts, meat, egg, and sunflower oil. These are the sources of tocopherol. Okay, now what is a deficiency disease? The deficiency disease is fertility disorder. Fertility disorder. The first problem is sterility in males, and then second one is abortion in the females. So even before the child is born, the child will get aborted. Okay, so that's how these are the two problems which you can see in the males and females. Okay, tocopherol, you can see the fertility disorders. The first one is you can see the sterility in the male, sterility in the males, and second one is the abortions in the females. So even before the birth of the child will get aborted. So that is a problem which we see in the females. So that's why tocopherol should be taken in very good quantities. And the last one is the phylloquinone. Phylloquinone. K, vitamin K is also called as phylloquinone. This has a very good relation with the blood platelets. So last year we have seen that whenever there is a wound and all, the blood platelets will come to that particular place and they will help in the clotting of the blood. And even the phylloquinone K is also very important for the blood clotting. So if there is no proper phylloquinone in your body, if it is deficient, then there will be delay in clotting. Delay in clotting. What will happen if there is a delay in clotting? The blood will keep on oozing. There will be severe loss of blood, which even kill the person, which even lead the person to the death. So phylloquinone K is responsible for clotting of the blood. So if the vitamin K is not present in your food or diet, if it is deficient in the food which you eat in your body especially, that will lead to the delay in the clotting of the blood, which will also lead to the overbleeding, over-oozing of the blood, and which will eventually lead to the death of the person. So these are the very, very important things we have learned today, that is about the vitamins. Hope you all understood this, so that you can get good knowledge on vitamins, and we'll definitely meet with the next unit in the next class. Until then, see you all.